If you could control a machine with your mind, what would you do? Turn on the TV without a remote, perhaps. Brew a cup of coffee. Send a text to a loved one just by thinking it. For people living with paralysis, using your brain to escape your body would be nothing short of miraculous. This is the promise of brain-computer interfaces, or BCIs. They allow people who can't move their limbs to perform everyday tasks. They can even help people who can't speak, communicate, just by using their thoughts.
Think, go, go, go. Almost like shout it in your mind. Go.
I'm screaming in my mind. You can't hear it.
Yeah.
But I am screaming.
Yeah.
Okay. I'm Manjula Selvarajah, and this is Solve for X, a series where we explore the latest ideas in tech and science. Today, we're exploring the potential of BCI. While these devices hold enormous promise for the future, a group of researchers right now, right here in Canada, is exploring ways they could help a population that's been historically overlooked. The researchers say the tech could make a seismic difference for millions of kids with disabilities, helping them participate in life in ways never thought possible.
They can change lives. They can change lives of people who have so far not been able to rely on existing assistive technologies and existing medical interventions to have a quality of life.
When Claire was a baby and we found out in seconds our world was taken from us, she would probably never walk, she would probably never talk, and those milestones seemed so big. And you realize in those moments that it's the inch stones that really matter, and they're not small. For Claire, for this girl who is the strongest person that I have ever met, when she gets to do something or when she finally does it, it is everything.
Today, several companies around the world, most famously Elon Musk's Neuralink, are racing to expand clinical trials and take this idea out of the lab and into everyday life. Generally speaking, these approaches fall into two buckets. Implants, like placing electrodes directly on the surface of the brain or within the nervous system, or wearable applications like headsets that read EEG more broadly from the scalp. While this could prove transformative for medicine, interpreting the brain's signals also raises some big societal questions. What happens to the neural data that's obtained, and how do we decide where the human ends and the machine begins? Could BCI lead to a new era of brain-powered innovation and healing? Let's get into it.
My name is Dr. Adam Curtin, and I'm a pediatric neurologist at the Alberta Children's Hospital in Calgary.
I caught up with Dr. Curtin during a rare pause between patient visits. His work sits at the intersection of medicine and neuroscience research.
I have a special interest in children who've had injuries to their brain around the time of birth, particularly stroke and other types of acquired brain injuries in the newborn. I see them in my clinical practice. I work in the intensive care units to see children with neurological problems. They are also the focus of my research program here, trying to understand how young brains develop after they've had a serious injury and try to help them to do the best they can and function better.
Children's brains, he says, are uniquely plastic, remarkably adaptable. His lab focuses on supporting their recovery. Part of that involves brain-computer interfaces.
We had a young girl in our intensive care unit a few years ago who had a brainstem stroke. She was only 13, and she was locked in, and the intensive care doctor, who's a very good doctor, saw her and said, after a few days was like, I'm really worried. I don't know if she's ever going to be aware of things. And I said, actually, I'm pretty sure she already is.
Being locked in or having locked-in syndrome is when someone is fully conscious but almost entirely paralyzed, unable to speak or move.
We had one of our very simple BCI systems, and so we took it to the ICU and we gave her a chance to do something just to show us that she was there, and she got it just like that. And the intensive care doctor was questioning his own judgment. He was like, gee, I made an assumption there that I really shouldn't have made, and he said it to her. He said, thank you for showing me that I made a bad assumption, and now I know that you're here, and I'm going to talk to you more. And so that was just a particularly good example of that.
What is it that she did?
At that time, we had pretty limited applications. She played a video game, and we had a way to hook it up, and we could train her to think a certain thought, and it would jump the character in the game. And then we would start the game, and she went along and jump, and she played it probably better than I could. It left no doubt that she was fully capable, fully aware, and yeah, that's what happened.
Each small success has a ripple effect. A child who can show they understand what's happening, who can express themselves in a new way, changes everything.
It turns out, in terms of the world's burden of people with long-term disabilities, severe neurological disabilities, the largest group are actually people who are born with those disabilities. So cerebral palsy is a general term used to describe many of such young people. And they are very much in need of this type of technology. In fact, they live for many, many decades. And for many children who I see in my clinical practice, they have a very high level of capacity. Many are intellectually normal. Some are quite gifted, but they can't move and they can't speak. And so their life is extremely challenging. And a new way for them to connect, like BCI, is extremely exciting with the potential that it brings.
BCIs are transforming medicine, but they're also helping to unlock the mysteries of the mind.
There is, if you look at the BCI literature, a lot of it is focused on it being a solution for severe disability like we've been talking about, but there's actually a whole sort of parallel or surrounding literature about how BCIs can be used to understand human behavior, human learning, brain plasticity. What we learn on the BCI sort of rehabilitation side teaches us a lot about the brain, including in complex conditions like we're focused on. And people who are using BCI to answer some of these other more fundamental questions, what they learn may be applicable to helping people with severe disabilities. So there is a nice sort of synergy between the two, and there's certainly been growth on both sides of that equation.
The growth Dr. Curtin talks about is pretty fascinating. Clinical work and neuroscience pushing each other forward, teaching us what the brain can do, how it heals, and how technology might help. Since at least the 60s, scientists have wondered if you can read the brain's electrical activity, could you use it to control machines? Or decode it well enough to know how a person wants to move or what they want to say? To get a sense of where we are on the tech side of things, I spoke with an expert who specializes in building and refining these devices.
My name's Anne van Hustenberg. I'm a professor of active implantable medical device technology at King's College London, and this is where you're reaching me today from in the UK.
Anne once pictured herself working on the teeny tiny microelectronics that make space exploration possible. Instead, she ended up working in another hostile environment, the human body. She's now designing the next generation of implants that interface directly with the nervous system.
I work on making the electronics parts sustainable for longer in the body in smaller dimensions.
We've been seeing a lot of coverage in the news about Neuralink, quite a bit actually in the last year. How much of that is hype and how much of that is real?
Can there be both? I don't think it's mutually exclusive. It's real. It's happening. They are implanting people with devices, but it's also very hyped in as much as I will meet people who think Neuralink were the first. They weren't, and they won't be the most advanced for very long because other companies are coming on. When I'm saying on the market, I still mean as clinical trials, but nevertheless are coming into availability for human participants to experience the BCIs. So they will be caught up with more advanced devices in the coming years.
What do they do right now? What do BCI interfaces currently in the market? And you were saying it's when we say in the market, we mean in labs. What can they do right now?
Not all of them, but most of them are interfacing on a computer. It may be a language-focused BCI. So what they'll do is after a lot of training, they'll be able to interpret the signals that they're recording and turn them into words, sounds, speech. These are really important BCIs.
Anne says there's also promising stuff happening around restoring movement, too.
There's a group in France and in Switzerland, so they're having brain-computer interfaces that will record the intention to move of people after they've had a spinal cord injury. And this is then combined with a delivery device that stimulates the spinal cord and helps these people with mobility, lower limb mobility usually.
So what's happening is that it's actually translating that, what do I call it, a brain signal into movement by the limbs of the person, not a robotic arm or anything of that kind.
Yeah, it's probably a little bit more indirect than that. So it's not quite bridging the area of the injury, but in experience, this is what it would look like to somebody not involved in the technology side of it. It is reading intention, it is decoding, and it is providing signals that, together with a lot of training and a lot of efforts from the participants, will enable them to move. And you'll find on YouTube or other media platforms videos of these people using the systems to take a few steps to be able to make movements that are otherwise impossible for them.
I wanted to see it for myself, so I looked up one of the videos Anne mentioned. It's jaw-dropping. Amazingly, some trial participants regained a bit of voluntary movement even after the stimulation was turned off, hinting at the body's ability to rewire itself.
So there's definitely an element of closing the loop, although it's not as straightforward as just sending the information from the brain to the bottom of the spinal cord injury.
Now the field is pushing further in a new direction to find less invasive ways to place implants. Anne explained how one company, Synchron, is skipping brain surgery altogether by threading implants into arteries, kind of like a stent procedure.
The speed at which a person using a Synchron device can generate words and sentences is remarkable. It's not amazing for somebody who speaks every day and doesn't think twice about it, but if you've lost the ability to speak, having a near conversational rate of generation of sentences is just remarkable. But then there is another element, which has been the demonstration of the long-term reliability of all of the technology that is used in the implanted parts. And this has been essential in seeing the number of clinical trials now being approved across the world. So there is an element of that which is not so visible, I guess. It's less exciting, but it's extremely important. And, it's always going to work if you have 5 engineers around you, but you want something that somebody can take home. And that's a very different level of product development.
All of this to me, Anne, sounds like a feat of engineering. I mean, you're talking about, something that the body doesn't reject. You're talking about something that's small with all of this compute power. There's so many aspects here. Just how difficult is it to build something that is tiny and long-lasting that goes in the body?
Oh, it takes so many different areas of expertise. So it's a feat of engineering, as you said, and it's so much more as well. From the surgeons, the anesthetic, all of the people who do the imaging, we have to make sure that the devices go where they are meant to be. And importantly, these devices must not interfere with the best standard of care that the participants, when they are patients in hospitals, can receive. So there's lots of questions around MRI compatibility or the possibilities of doing imaging of the brain whilst they have this device. So there's a whole element of interdisciplinarity even within the clinical area.
I want to step back for a second. I want to understand the potential of BCIs here. How transformative could they be for science and medicine?
I like your question because it's certainly transformative for medicine. There will be a lot of stroke survivors that will in the future benefit from these devices. It's also changing science in many ways. From the most obvious, we get access to more data, neural data. So we will see a lot of improvements in our already very good understanding of neural functions in humans. Assisted breathing, where currently assisted breathing is a ventilator. And that's got a lot of issues, as you can imagine, in terms of that person being able to be mobile, that person being able to sleep comfortably, those people being able to communicate as they have to have the ventilator on. And I should imagine that in my lifetime, certainly we will see fully implanted breathing assistance through BCIs, and further development of the technology is required, but they're coming. So that's a new area that we're definitely going to see. There will be others in, as I said, in control of bladder, bowel, in control of pain also will certainly be improved further. There's already a lot of work on neuromodulation and implanted neuromodulation for pain. We're going to see that a lot more.
Even as we wait for some of the implant developments Anne's talking about, which could still be years away from reaching patients, Anne says we're on the brink of change.
I think we're seeing a moment when everything's coming together to turn research devices into actual medical devices, which means we're going to go beyond the trials. People will start benefiting from this technology. People already are, but the numbers will grow. And we're serving a community that has for a long time been underserved by other medical progresses. And that's really exciting to me, to see people who were not able to be in the community to their full potential receiving attention.
And you're talking about people with disabilities here.
Yes.
People living with disabilities.
Yes, people living with disabilities, people living with mental health issues that were not responding to the mainstream pharmacological interventions. These people have, to date, not had any hope. And I think these devices, it's not just hope, it's actual practical change. It's life-changing. It's not hoping for life-changing. It will be life-changing for a lot of people.
It's clear the technology has come a long way since the first patient received an implant. That was in 1998, to help someone who had had a brainstem stroke move a cursor across the screen. Since then, BCI has become a lot less clunky and a lot more efficient at reading and interpreting brain signals.
Still less than 100 people in the world have implanted brain-computer interfaces, but that's changing quickly. And so the concept has made great progress, but it's always been very limited by the technological complexity, the, some would say, invasiveness of having to have a chip in your brain and a cable literally in your head. The technology advances are starting to minimize some of those difficulties. So that field is booming and moving forward very quickly. Still almost entirely in adults, although, as I said, we're trying to advocate for the inclusion of young people in that progress.
Why do you think so far kids have been left out of that space or not being treated by these technologies?
There's no doubt about the need for young people, but because they're born with these conditions, their brains, they have never had the chance to go through the normal phases of development like we all did, where we learn to walk and talk and use our hands. That's how all of our brains are now hardwired and quite predictable about where functions live and how the brain works. All of those rules are kind of go out the window when you're born with a condition like severe cerebral palsy. And for brain-computer interface, everything that's been done to date relies on some knowledge of how does a typical brain work? Where are certain functions located? Where should we detect the signal? And you can do that very reliably in adults who became paralyzed because their brains are normal. Kids with cerebral palsy, they're all very unique. And so it's probably that complexity of that underlying problem that has been the single biggest factor as to why it's not that the BCI world doesn't want to help kids with cerebral palsy. They're just, sometimes I joke with my neurosurgeon friends and who are usually not very easy to intimidate, but I say they're afraid of kids because their brains are really complicated. We're trying to get them to change their thinking on that.
Dr. Curtin remembers the first time he heard about the promise of the technology.
I remember turning to my engineer and saying, we need to look at this. How are we ever going to catch up with this? And the big international meeting for BCIs was happening the following month in California, and we said we should just go. And so we went, sat in this meeting for 4 days with all the BCI experts from around the world, and we were the only pediatric people there. It was all been focused on adults. I was one of the only clinicians there. It's all very technical engineering type people. That was kind of one of the first steps. That got us really excited. Since then, that was about 6 or 7 years ago, we've been trying to change that. We've been trying to fill that space and help kids catch up to the very exciting world of BCI technology and progress.
After that conference and seeing just how much potential there was for kids, Adam's team picked up some off-the-shelf BCI headsets. They then started building their own applications designed specifically for the families in his practice. And that took them along a whole other path.
stuff we've been developing is working, and it's helping kids in our local area, our city in southern Alberta here. But that's, a fraction of 1% of all the kids out there who might benefit. And so trying to scale the concept on research dollars and the clinical healthcare system is literally impossible. We could work on it for the next 100 years. We would never get there. And so commercialization became an obvious avenue to do that. This was all new to me. I'm a doctor. I have no business background. And even 3 years ago, I would have said, oh, you only commercialize if you've patented some miracle new drug or something like that. The University of Calgary here, where we work, is very entrepreneurial. And so we've really taken advantage of that over the last 3 years to start this company. Dion was a PhD student in my lab. She did a lot of the seminal early studies working with the family, so she gets it. She understands the tech. She understands the families and the kids. But it's been really eye-opening, and it really is a whole new pathway to impact, is the way that I see it as a clinician and a researcher.
Dr. Curtin wanted to figure out how to get BCI into the homes of families who need it. So he and his PhD student, Dion Kelly, co-founded a startup called Possibility Neurotechnologies. Today, they work with over 150 families from around the world.
To have a potential, even if it's simple to start, but a potential solution or opportunity for them is really, really exciting.
I'm Dion Kelly. I'm the co-founder and CEO of Possibility Neurotechnologies.
I had the chance to speak with Dion about the device she and Adam have developed. It's called Think to Switch. With access to an EEG headband, a smart plug, and a bit of training, it can help kids with disabilities turn on and control a range of household objects.
We're not marketing this as like a medical technology. It's a technology for anybody who wants to control things or interact using their thoughts. And the idea is that, kids of all abilities will be using this so that they can interact on a level playing field.
What have you seen that's blown you away with Think to Switch?
With the communication aspect that we've enabled on this, that's been pretty fantastic because the users, often kids who have never been able to communicate before, are able to communicate their choices.
There's one young girl in particular who stands out to Dion, Claire.
And her teacher uses it with her, which is unheard of in the assistive technology space. Like, technologies aren't simple enough for teacher or even an average person to just set up and start using with someone.
Dion explained that for Claire, who has cerebral palsy and who can't speak or move her body, having a device she can bring with her and use easily with other people in class is important.
Her mom sends the iPad in her backpack, sends the headset, and her teacher sets it up for her at school, and she chooses her library books, and she chooses which activities she wants to do in art class. She chooses which colors she wants to use for her art projects.
And she uses the headband on this page as an example to go and pick the book that she wants.
Mm-hmm.
So my name is Stephanie Sonnenberg. My daughter's Claire Sonnenberg, and we have been using BCI since she was 3, and she's turning 10 this year. She is spunky and smart and funny. She is probably the happiest person that I have the pleasure of knowing. Claire has cerebral palsy. She has a hard time using her arms and her legs, so it's difficult for her to do things on her own. We tried switches, which is when you use your arms or your leg or your head, whatever you can, to activate a switch to make a choice or for it to talk for you. So Claire can do it for a bit, but then her muscles get tight and her arm doesn't want to reach for the switch anymore, and it's very frustrating for her. Some people may just have one little issue. They may walk with a little limp. Some people, it might just affect their speech. So for Claire, unfortunately, she is quite severe.
Claire was one of the first kids to try BCI in Dr. Curtin's lab. Stephanie still remembers that day.
Dr. Curtin was there with his team, and what he said to me was, if she can't do this, then that's okay. This is hard. And we went into the room and they put all these electrodes on Claire's head, calibrated everything to her brain. And then they told her to think go. And she turned a light on. And I just remember looking around the room and everyone was smiling and writing stuff down. And I just knew at that moment that a door had opened for Claire. I didn't know what door, but it was something exciting that would change her life.
Stephanie invited us to visit Claire at school. She's now in grade 4, to watch her and her best friend Haley create art together.
Oh, there we go, Claire. Okay, keep going.
Is this one of her favorite things to do? Creating spin art?
It is. So she makes lots of greeting cards. She makes ornaments, all using the spin art. Hey, go. Go. Yeah, there we go.
I asked Haley to walk me through the steps involved.
So I'm adding the paint onto the paper, and she's using her brainwaves to activate it. So it will cause a cool creation when she thinks go.
That pinging sound is Claire's brain activity firing when it activates the BCI. A little while later, the painting is finished. A kaleidoscope of pink, blue, yellow, lots of glitter, the girl's favorite. Stephanie told me that Claire can now do all sorts of things. Make milkshakes and cookies, play musical chairs with her brothers, she's the DJ, slice cucumbers for pickling. The device gives her a kind of autonomy and agency that nobody could have imagined a decade ago when she was born.
Claire was always involved in all of our activities, but, we had to move her hand for her or say something for her, make a choice for her. And this has given her complete independence. She's her own, player in the game. She has her own role that is separate from our roles. And that is so important. We take for granted sometimes, I think, what we can do. And watching someone who has worked so hard, to have that active piece, BCI has brought us complete happiness.
It's amazing to think that even a relatively simple BCI device, basically an app and an off-the-shelf headset, could have such an impact. When Dion offered to let me try it out for myself, of course I said yes. So how do we get started?
Okay, so I'll first get you to relax your body. So sitting with your feet flat on the ground and your hands just resting on your lap so that your body is as relaxed as possible.
Picture this. I'm sitting in a studio. I have a headband on. In front of me is a tablet. And by my side guiding me is Dion.
What we typically suggest is doing inner speech. So when I press go here, you are going to say go in your mind.
So we're training it now.
And this is really important because this technology doesn't just read your mind, which is a big misconception. It only reads what you teach it.
Okay. I'm about to try to click on something using just my thoughts.
Right now I have the sounds muted, but I will unmute them. And now think go.
Hello.
Oh my gosh. Just by thinking the word go, I was able to activate a smiley emoji.
Yeah.
Wow. That felt really good. And it felt even better when Dion said I had decent control of my inner speech. Don't we all like to think we're in command of our own minds? But this was just the beginner level. I wanted to try something a bit more challenging, like choosing a book from a library of options. I think I'm going to try to make my way to where is the green sheep. Let's see.
So that's the last option.
Why is that not working for me? That's interesting. Because the last one was so definite.
Yeah. So it involves a lot of working memory as well.
It does need practice then.
Yeah. So I usually go into here, get people to play around with it so you can even just start to learn what it's like to activate something with your thoughts.
Does the system learn about me as well?
Yes, so the system is learning to decode your intent.
Okay.
And you're learning to produce more consistent brain signals. So you guys are helping each other out and learning about each other.
Okay.
So now we'll go back in and just add another 36 seconds of calibration data.
Trying it myself was strange and amazing, harder than I imagined. But it made me think, As this kind of technology spreads and similar devices, both implanted and wearable, get out in the world, most people won't have a neuroscientist like Dion guiding them or explaining what's happening. And when something starts to look like mind reading, how do we make sense of it? Where do we draw the line? I brought these questions to Anne van Hoostenberg to hear her perspective on what comes next. Would you call it mind reading, Anne?
No.
Just
No, simply because for the two things. The first thing is even the more advanced implantable brain-computer interfaces only see one small part of your cortex. So they only see a little bit of the whole of your brain. And if you think about the wearable device that you had, it was around your head, but it wasn't precise. So it would be like trying to read a book by seeing the front and the back cover and a sort of a page in the middle and only 5 words on those. You wouldn't be able to read it, even though I gave you the whole book, until you were trained to recognize the characters and their meaning and their interpretation. And that's why it takes hours of training to be able to use the more complex devices. The headband that you were using, you had to concentrate, and there was a little bit of a training process where the machine was learning what your signals look like when you think that, and it was trying to identify a pattern that was unique to that thought in all of the noise of all of your other thoughts. Because I'm sure at some point you were thinking about ice cream or anything else, and it's got to identify everything that's not interesting, reject it, and just pick up these unique patterns. So they're not reading your thoughts, they're identifying these patterns that you have trained it to recognize.
And despite the hype you might hear about mind melding or human-machine fusion, that future isn't here yet.
We're not yet at the stage where we're augmenting humans. Let's just be serious. If you want to order a pizza, you take your phone and you order the pizza, or you go online.
And
you're not going to wear that headband. You can imagine yourself
and dream up a pizza.
If your experience was anything like that of most other people, you'd be frustrated before you'd written the order correctly, and you'd end up having sort of 3 colas and no food whatsoever coming to your home. But there is a huge amount of potential for different categories of people, either people who are non-communicative or people who for other reasons can't. So they may have paralysis, they can't use a keyboard, or maybe with difficulties. There's also, again, with the headbands, a whole host of mental health applications. Because if you experienced it, you had to concentrate. You had to do something patiently. You had to do it. And you can use that in a game version. So there's trials on autism, there is trials on depression. There are different companies working in this field. There is a huge potential benefit here with the wearable devices.
What do you think we have to be careful about as we see this technology develop? I mean, we're talking about some of the stuff that we've talked about is invasive and very much on the cutting edge.
The risk that is the most talked about in the communities in which I am most involved is trusting the interpretation. So you have a brain-computer interface, and you've trained it, as I explained previously, to decode your alphabet so that you can use it to communicate. How does anybody know that what you're saying through this machine is truly what you're thinking if you are unable to communicate otherwise? Maybe initially when you were training it, you consider it to be trustworthy and it was reproducing your intended communication in a way that you felt, oh, well, maybe I wouldn't have chosen that word exactly, but okay, I'm fine with that. But progressively, it may start, and I say it may because this isn't something that that is happening, but there is a risk that the machine starts interpreting faster and taking it a little bit more loosely with your intention, always with a desire to enable you to communicate more conversationally.
Anne compares this to the way predictive text can take over typing. At the start, it can feel helpful until it begins shifting the way you speak.
But as the person that has control, you can stop using the predicting text and type the word. So we will be faced with questions about the trust we put in these interpretation. At what point does that barrier gets crossed and the machine makes a decision that wasn't yours? So trust in all of that will be really important. And these are debates we must have now.
And then there's the question of neural data, how it gets used.
I understand this is really concerning, and it should be concerning because it's not like we're short of stories of people using things that we gave away unsuspiciously, and we should have been a bit more careful. But at the moment, it's lower on my radar because of my concern with trust and the fact that this is something that people aren't aware of and that we should really be aware of. Thankfully, the communities that were part of the scientific communities are taking this extremely seriously. There's a huge amount of work on trust in AI and trust in all of these interpretative devices. As far as neural data, thankfully, regulators across the world are starting to put in place frameworks for that. I think these risks start as philosophical questions, but they go beyond that. Being aware of them and thinking about them, and therefore thinking about how, as a community, we respond to that, because we're not going to stop. There's only one direction. Like a lot of other innovation, there is a nefarious side to them or a potential misuse of the technology, but that doesn't stop us from progressing the technology. And so it's about how, as a global, worldwide tech community, we respond to that and how many actors we engage in this process of discussion to make sure that everyone is heard. There are always imbalances in the way some fractions of some populations in some countries are so much more dominant in these conversations. So another thing we're doing in all of that is making sure that we think about everyone, or trying to think about everyone.
And that becomes even more complex when the everyone we're talking about includes children. As Adam Curtin sees it, there's also a moral imperative to not leave children behind as implant technology advances.
This is the future of the technology, where its capacity will go up exponentially as that approach gets refined to be safe and accessible. And it's already, as I said, made a lot of progress there in the adult world. And so we're seeing progress on the pediatric side in that space occurring over, we think, about the next 5 years to see that become a reality for people with cerebral palsy and other pediatric onset conditions.
As Adam thinks through the potential evolution of the technology and the complexity of not leaving children with disabilities behind, I keep returning to the moment I saw Claire using her BCI.
Good girl. Should we look at your art, Claire? Should we take a minute and let it stop?
It did feel, quite honestly, magical. There's lots to think about as we see BCI develop, but how it'll shape the future is a matter of debate and ongoing discussion. What strikes me as perhaps the most hopeful thing is what it could enable. The new freedom it promises for so many also represents a kind of freedom for all of us, to come closer, to see one another, to connect. Solve for X is brought to you by Mars. This episode was produced by Ellen Payne-Smith and written by Jason McBride. Lara Torvey, Sana McBool, and Sarah Liss are the associate producers. Max Swain composed the theme song and all the music in this episode. Gab Harpel is our mix engineer. Catherine Hayward is our executive producer. I'm your host, Manjula Selvarajah.
Solve for X is brought to you by Mars, North America's largest urban innovation hub and a registered charity. Mars supports startups and accelerates the adoption of high-impact solutions to some of the world's biggest challenges. For more information, visit marsdd.com. And we want to hear from you. Drop us a line to share your ideas, questions, and feedback. What innovations are you curious about? Email us at media@marsdd.com.